Greetings and thank you for joining me for today's Innovations in Facial Plastic Surgery update. I'm Dr. DJ Verrett. Today I'd like to speak with you briefly about otoplasty or ear reshaping surgery. Otoplasty is generally done for people who have what appear to be Dumbo ears that stick out far from their head. Usually it's done at a fairly early age because kids are teased during school if they have prominent ears. It can be done though at any point in a person's life if they consider it to be a problem. When approaching otoplasty, it's important to determine the appropriate timing for the surgery and exactly what surgical procedure to perform. Timing for otoplasty generally correlates with the start of school. Otoplasties can be performed at about 5 to 6 years of age, though it does require general anesthesia, as patients at that age generally cannot cooperate with the extended period of time it requires to perform the surgery. Surgery itself can take anywhere from 1 to 2 hours depending on the complexity of things, and children about 5 to 6 years of age usually can't hold still for that long. In older patients, adolescents, or adults, the surgery can be performed with local anesthesia, usually in an office setting. Otherwise, the surgery is an outpatient procedure. The key to the surgery is determining if the patient has an appropriately formed ear or if they have excess cartilage. There are two important structures when looking at otoplasty surgery in the ear. The first is what is termed the antihelical fold. This is the fold just on the inside of the outer rim of the ear. If this is not formed correctly, the ear will look flat and appear to protrude farther out from the head. By simply recreating this fold, the ear can be brought into proper position. The second area that could be a problem is excess cartilage of the conchal bowl, the conchal bowl being the deep part of the ear. By removing excess cartilage, the ear can again be brought into a more proper position. Sometimes a combination of the two approaches must be used to perform the procedure. The procedure itself is fairly straightforward. An incision is made behind the ear so that it is not seen, and the skin is elevated off of the cartilage or the supporting structure of the ear. The cartilage is then either removed if it's excess conchal cartilage, or permanent stitches are placed which recreates the antihelical fold. Now these stitches do stay in forever, and they are the key to maintaining the shape of the ear. So there is a possibility of them breaking over time, and if this happens, sometimes the procedure has to be repeated. The incisions are closed, and the patient is generally asked to wear some type of headband for at least a week to prevent formation of any blood clots within the ear. In my practice, I generally see patients the day after surgery to make sure that they don't have any blood clots, a week after surgery, and then out from there. Patients are asked to wear a tight head dressing looking kind of like a mummy's wrap for about a week, and then they're asked to wear a light headband day and night for at least 1 to 2 more weeks, and then a light headband for at least a month just at night. For more information about otoplasty and other innovations in facial plastic surgery, please visit my website at www.innovationsfps.com. I'm Dr. DJ Verrett. Thank you so much for joining me. I really appreciate it. Have a great day.